let me explain this question to you, right? So that we understand what the NCLEX is saying. Now look at the first part. Now, one thing I want you to do when you're answering question all the time, pay attention to foot stop, right? Foot stop. Because when the NCLEX use foot stop like this, it means that they are trying to pass another message different from the previous message that have been passed to you, right? Now look at what the NCLEX said here before they stopped right here. Now they said the nurse is caring for a client. Now this is who you are caring for, but this client, they have what? Their spouse and two adolescents. So who are you caring for? This client. Now, but there's a reason why the NCLEX is describing the spouse and describing who? The two adolescent children, I mean. Now, the second part, which end right here, said the client has been admitted to the hospital for treatment of TB. Now, it now makes sense to me why the NCLEX is describing the client and then the spouse and two adolescents. Because now, what is TB? TB is what? Airborne infection that can be transferred from one person to another. Now, it now makes sense why the NCLEX is telling me about the spouse and adolescent side, because right now I'll be thinking both both the client, their spouse, and what the two children, we probably have what? The TB. Now, that is the information I know until this point. Now, look at the next part. The NCLEX now said the local health department has been notified about what? The client diagnosis. Now, there's what we call mandatory report, right? In a sense that we are trying to report what? TB, right? HIV, abuse, neglect, gunshot wound, stab wound, all these things, by law you need to report them, right? As a nurse, you need to report them. You don't keep all these things confidential, you report them. Abuse, neglect, assault, TB, HIV, gunshot wound, stab wound, you report these things. Now, TB is one of those things we report. That is the reason why they said the local health department have been notified about this situation. Now, the reason why all these things need to be reported, most especially the infection one, which is your TB, HIV, is because all these kind of things need to be controlled. If not, if this department don't control the spread of all these things, a lot of people can have it. That is the reason why these are very dangerous to the society. That's the reason why you report them. Right. So now, these people are in charge of making sure that they control the spreading of this kind of infection. And if it is for abuse, maybe the department that belongs to abuse are trying to control the fact that people don't get abused. Same with violence, which is gunshot, stab wound. The police officer is trying to prevent all this kind of violence, right? So each department are trying to prevent something. So the public health department, they are trying to prevent the spread of infection. So now the information they have is that the patient stay with the spouse and two other children. So now health department will now be thinking there's possibility that the spouse and two other children that are in contact with this patient, maybe they have the infection. But who is currently diagnosed of the infection? The client. This patient is not diagnosed. This patient is not diagnosed as at yet. And also, before you can isolate a particular client or a particular person that have been in contact with somebody who have TB, they must show either sign and symptom, or you must suspect based on sign and symptom or confirmed diagnosis. Right. You must suspect due to the sign and symptom they are showing or confirmed diagnosis. One, this question is not telling us that the spouse and adolescent have a confirmed diagnosis of TB. That is one. Two, there's nowhere in this question that is telling us that they are showing sign and symptom related to TB and then we are suspecting TB. The only two valuable reason why you isolate somebody that have been in contact with someone who have TB is if you are suspecting them based on sign and symptom or they have confirmed TB. So that is why you isolate. Now, the examiner is now asking the nurse should recognize that After this notification, the local health department will, now me and you now know what the local health department will do, because now they want to control the spread. So they will be in contact with what? The spouse and the two adolescent children to find out if they also have what? TB. Right. But the question is not saying they are suspected based on any sign and symptom, or they have confirmed TB. It's only the client that have confirmed TB. So at this point, we need to find out if they have. That is the first thing we need to do. They are not showing signs, so we need to like find out. Right. Now look, schedule periodic examination for the client chest and sputum. This is not the local health department problem, because this is the nursing problem, because obviously local health department stop the spread. So this belongs to the nurse, because it's the nurse that need to be like doing examination for the client. That is the nurse and the client. The only thing is to stop the spread. So we are looking for answer related to stopping the spread, right? Or like, trying to like find out. There are more things local health department would do, right? So now, contact the client family to arrange for family member to be examined. This is a good thing to do. Now, immunize those person with whom the client has been in contact. Now, take for instance this: somebody has been in contact with somebody who have what? TB. Do you think if you immunize them, it will solve the TB? No. What these people need is treatment, not immunization. It's treatment they need. So immunization will not work after someone have TB. I'm not saying they have TB, because the question is not telling us if the spouse, the two adolescent child have TB. But take for instance they have TB. Would immunization solve that? Obviously no. So immunization is not the first thing to think about, because right now it make logical sense, because as a nurse we think logically, right? It makes logical sense that a client have TB and they stay with their spouse and two adolescents. It makes logical sense for us to be thinking there's probability the spouse and the two adolescent child have what? TB as well. But that is not enough to now say you want to isolate them. You need to see sign and symptom, or they should have what? A confirmed diagnosis of what? TB. But the question did not say there's any sign and symptom. The question did not say there's any confirmed what? Diagnosis that the spouse and two adolescents. So we cannot think about isolation yet. We can only think about either examination, or we think about assessment. Oh, examination is just the answer. There's no how to explain this. Now look at this one that is saying isolate. I will never even go for that, because you cannot isolate the patient yet. Do you understand what I'm saying? So that is the reason why your selection, right, that you selected for is wrong. That is the reason why 4 is wrong. Do you understand? Right. So understand the question so that you can be able to get the answer correctly. Right. So yeah, this is just the explanation to this question.